Hello, my name's Brittany. I'm going to be your nurse today. Can you tell me your name and date of birth?
Yes, it's Marcus Williamson, August 19th, 1994.
Okay, everything adds up. Can you tell me what brought you in here today?
Having severe stomach pain.
What kind of pain are you having?
It's like a gnawing, burning pain.
Okay, does it get relieved with food, sleeping, water?
Yeah. When I eat and when I sleep, it helps a lot, and I've been taking some Aleve for pain.
Do you take a lot of Aleve?
Yeah.
How much do you take?
Probably 3 or 4 a day.
Oh, wow, okay. Do you smoke?
Yes.
How much do you smoke a day?
Probably a pack a day.
Okay, how much alcohol do you drink, if you drink any at all?
Yeah, I do drink every evening.
How much do you drink?
Probably 5 or 6 natty daddies.
Alright, so about how much is that?
Or a case of beer.
Okay. Is that an everyday thing for you?
Yes.
Okay. So, have you been having frequent bowel movements? Have you been urinating okay?
Yes.
Okay. Is there a stool color to you that stands out?
Some of my stool has been dark.
Okay. Is it painful or it's just dark?
Dark and kind of painful.
Okay. Well, I'm going to go speak with your doctor and he'll be in here shortly, okay?
Okay.
Okay, Mr. Williamson, I spoke with your doctor. Did your doctor come in here and talk to you?
Yes.
Okay, so he is suspecting peptic ulcer disease. Did he tell you that?
Yes.
Okay, so we'd like to do an H. pylori urea breath test to rule out the H. pylori infection. He's thinking because of your NSAID usage, which is what Aleve is, he thinks that you may have peptic ulcer disease. So if we have your consent, we're going to go ahead and do the H. pylori urea breath test.
Okay.
Okay, let me go grab that for you.
Okay.
Okay, I have your test here. So what you're going to do is you're going to breathe into and out in this bag, and it's going to test your carbon dioxide level. And then after that, I'm going to go ahead and give you a urea drink. You're going to drink that, and then I'm going to come back in 15 minutes and give you that same bag again so you can breathe into it, and we'll test your carbon dioxide levels at that point too to detect the H. pylori.
Okay.
So you can go ahead and breathe in and out. And here's your drink, and I will go take this to the lab and we'll test that. You can take a drink of that. Alright, your 15 minutes is up, so if you'll go ahead and do that again so we can test it. Alright, that should be good. And your doctor will be in with your results.
Thank you.
Peptic ulcer disease is a disease where open sores, called ulcers, develop in the lining of the stomach due to a decreased mucus production. Peptic ulcer disease is most commonly from H. pylori bacteria or chronic NSAID use and alcohol use. The H. pylori bacteria sticks to the layers of the mucus produced in the digestive tract, which causes inflammation and breakdown of the protective mucosal lining of the stomach. This breakdown can then lead to ulcers. The frequent NSAID use, kidney disease, lung disease, liver disease, alcoholism, smoking, stress, an increased amount of spicy foods, and familial history can all increase an individual's risk for peptic ulcer disease. Some common clinical manifestations of peptic ulcer disease include a gnawing, burning pain in the right upper or middle stomach, between meals or at night that can be relieved with ingestion of food, dyspepsia, bloating, heartburn, nausea, vomiting, dark brown stools, weight loss, severe pain, intolerance of fatty foods, belching, trouble breathing, and appetite changes. Weight loss can also occur. Some diagnostic tests that can be done to confirm peptic ulcer disease are an endoscopy with biopsy, the H. pylori test, and imaging like CT and X-ray. The urea breath test and the stool monoclonal antigen test are both accurate tests that can detect the presence of H. pylori and diagnose peptic ulcer disease. In the urea breath test, the patient is given a bag they will breathe into at different intervals. After breathing with the bag, their carbon dioxide is expelled and detected in the lab for their levels. Once the carbon dioxide baselines are established, the patient is then given a lemon-flavored drink that contains urea. They will drink the drink, and in 15 minutes, the nurse will come back and obtain new carbon dioxide levels with the same bag they used earlier. When H. pylori is present, there will be a higher level of carbon dioxide in the reading that was taken last, after the lemon-flavored urea drink was ingested. If peptic ulcer disease is left untreated, it can lead to bleeding, perforation, gastric obstruction, and even gastric cancer. Proper nursing interventions are vital in the prevention of peptic ulcer disease. Education to patients on the importance of smoking cessation, adequate hydration and nutrition, and NSAIDs can help lower the incidence of peptic ulcer disease. It is important to educate patients on NSAIDs and their relationship to peptic ulcer disease. Tylenol is a great alternative for pain relief. If NSAIDs are not able to be taken out of the patient's medication regimen, they may be able to reduce their dose to a lower dose. The incidence of H. pylori can be lessened with the proper preventions like using proper food handling and preparing techniques, practicing proper hand hygiene, and using caution when choosing medications for pain relief. The treatment for peptic ulcer disease can include proton pump inhibitors like Protonix, H2 blockers like Pepcid, antibiotics for H. pylori, and other protective medications. Patients will often say that milk and antacids help with relief, but these alternatives are not recommended. Milk can cause an increased production of acid, so it should be avoided in people and patients with peptic ulcer disease. Antacids can also give relief, but should be avoided because they can interfere with effectiveness of other medications, and the patient may be put on different medications for peptic ulcer disease if antacids cannot be taken out of their medication regimen. Okay, Mr. Williamson, has the doctor come in and told you your diagnosis yet?
Yes.
Okay, so I am just going to talk to you a little bit about your diagnosis of peptic ulcer disease.
Okay.
So with this diagnosis, you're going to want to stay away from the Aleve, the Motrin, the ibuprofen. You are also going to want to cut down on your smoking and your alcohol use to help heal your stomach. Do you think you'll be able to do that?
I'll try.
Okay. What do you know about peptic ulcer disease? Do you know anything about it?
No.
Okay, so your H. pylori breath test that you were just doing came back positive, which means that the carbon dioxide level on your second test was higher than your first test, and that tells us that you have H. pylori in your stomach, which it's common, it's present in 50% of the population's stomach, but that helps the ulcers grow because that H. pylori destroys your lining of your stomach, so then ulcers just form. But the NSAIDs and the alcohol don't help either because they're so acidic. So we want to cut those down a little bit. We want to increase our water intake. And then for proper healing, we also want proper nutrition. So increase your protein, your vitamins, your nutrients, all that good stuff. Okay, do you use proper hand hygiene, proper food handling techniques?
Yeah, I'm pretty clean.
That's good. That'll help with the H. pylori. Oh, I ran out of storage. So if you start to have any type of pain where we don't want you to take NSAIDs, are you familiar with Tylenol?
Yes.
So Tylenol's pretty good for pain relief, so you can go ahead and take that. That won't upset your stomach like the NSAIDs will. And it's really important that we get this under control because if we don't, it can lead to bleeding, which your doctor is going to set up a stool occult test for you since you said you're having dark, bloody stools. That can indicate blood in your stool that could have been caused by the ulcers. So getting this under control will help you with future bleeds. We don't want a perforation. We don't want an obstruction, none of that. And you definitely don't want gastric cancer. That can happen if we don't get it under control. So your doctor prescribed you Protonix, which is a proton pump inhibitor, and that will help with the healing of your ulcers, but there's some other medications if that one doesn't work out for you. There's H2 antagonists like Pepcid, and then there's antibiotics that your doctor will prescribe you for the H. pylori bacteria. So we talked about the smoking, the alcohol, the NSAIDs, and stress. Stress can also cause ulcers. Are you under a lot of stress?
Nah.
Do you practice stress techniques?
I'm pretty chill guy.
Yeah, okay. So I don't want you drinking milk to try and relieve the pain or antacids. Do you ever try to do that?
No.
Okay, so the milk can cause an excess in acid production, so we don't want that with the stomach ulcers. It can give relief at first, but it's going to cause more acid buildup in your stomach, and that can make more ulcers. Then the antacids, they may interfere with the medications that you're on, so we don't want you to take those. And then we will see you back in a month. Does that sound good? Do you have any questions for me?
How long do I gotta do all this?
Probably until your ulcers are healed. We'll do another test. Ulcers normally, depending on the person, heal in a couple weeks to a couple months. It just depends on the person, the diet, the hydration, and if you follow through with the smoking cessation, the lowering the drinks of alcohol you have every night, and the NSAID use.
Okay.
And if you do that, you should be in pretty good shape the next time we see you.
Right on. Well, I hope so.
All right, you have a good day.
You too.